Hello everyone, welcome back to my channel. If you are new here to my channel, my name is Cor and I'm your Bistek nurse from Southeast England. I know it's been a while that I have done a sit-down vlog, but today will be my comeback video, and this is about my opinion or my take regarding the recent incident in the Philippines that involves a nurse. It was a Thursday morning, October 17 of this year, when a 51-year-old female nurse was stabbed to death while on duty. The nurse was working in a medical ward in a hospital in Bohol, Philippines, when the 31-year-old male suspect stabbed her multiple times to the chest and back using a pair of scissors over a joke about being discharged home even after settling the bill. The suspect found the nurse's statement upsetting, which triggered him to do the unthinkable act. Not only he stabbed the nurse, but a utility worker who intervened in the situation was also hurt. The utility worker got away after getting stabbed in his abdomen and immediately reported to the security. The suspect is currently in the custody of Tagbilaran police, and he stated in an interview that he regret the killing. Now let's step back and look at the bigger picture of what could have triggered the incident and what could have been done to prevent this from happening again. According to the news, the suspect was admitted in the hospital due to food poisoning. The night before being discharged, the nurse, who was the victim, uttered words that could have upset him. On the day of his discharge, he grabbed a pair of scissors and attacked the nurse. There is no information about the exact words that the nurse said to the patient that might have triggered the behavior, but I have read in an article that the nurse have made a joke to the patient, that she said that, "Oh, you'll not be able to go home. Only your friends who were also admitted to the hospital will be able to." So I'm not completely sure what were the exact words that the nurse said to the patient that could lead to the attack. So what could have possibly caused the suspect to do such action? Factors could be that he is emotionally or even mentally unstable at the time leading to his hospitalization, but it wasn't declared nor explored as the focus of his care is about the food poisoning. Another factor could be financial problem. We all know that the system of healthcare in the Philippines comes with a cost. The suspect could have been dealing with a financial crisis, and being in the hospital piled up to that problem. Lastly, as someone who is unwell, coupled with stress and possible mental health issue, overstimulating environment could have triggered him in a way. I am a nurse myself, and I know that working in a hospital, especially in the Philippines, is not only exhausting but overwhelming, whether it be a private or public hospital. Nurses are overworked, underpaid, and unappreciated. To add to that, most hospitals are understaffed. Tell me, what could have led to her death? Is it her attitude? Is it poor training? Or is she just a victim of an unfortunate event? Or is she a consequence of a poor healthcare system in the Philippines? I won't deny it. I also get easily annoyed over small things at work because our body and mind can only take so much, and having to deal with patients' needs plus their families' demands can be quite overwhelming. The workload can be too much for one person to attend to, and the pay is undeniably low. That's why we can't blame nurses opting to work abroad. I myself can attest the difference of how nurses are treated back home in the Philippines as compared here abroad. It is sad to say that the nurses are being viewed as an accessory to the doctors rather than being part of the team that looks after the patients. If I may share to you some experiences I had when I was working in the Philippines, there are a lot of occasions that we have been abused emotionally. For instance, one of my colleagues had an encounter with one of the relatives of a patient, and what happened is that that relative went straight to the nurse's station and took a video of her harassing her and telling her, I'm gonna post this in the social media and to show all the people how unprofessional you are." And my colleague was just silent and just listening to all the rants of that relative. If we can't meet their demands, they burst, and the people use the social media to publicly embarrass them, which is definitely unacceptable. Honestly, in the UK, I have seen a lot of signages in every healthcare facility that I've been to Whether it be a clinic, a hospital, or a pharmacy, there's a signage that abusive behavior is condoned in this facility. So if there's one person that will show any abusive behavior towards the staff in a healthcare facility, they will be removed from the facility and their needs will not be catered. That's how firm they are in making sure that the staff are not abused. Another example when we receive abuse at work is when they're taking video of you while you're doing cannulation. And instead of stepping back, they will take a video of you to make sure that you really do your best that you get the vein, or else your face will be posted around social media. And it's totally unethical, honestly. Another good example is that when a relative sees a nurse that is looking so young and inexperienced, what they will do is they will research a certain drug that the patient is receiving, and then they will test the intelligence of the nurse if they have knowledge about that medication, and embarrass them if they don't know based on their Google research. Let me just emphasize this. I am not defending the alleged behavior of the victim, but I want you to picture out the reality in the healthcare industry. She might have said upsetting words to the suspect that triggered him to act violently, but if she should have known the holistic medical background of the patient, having the appropriate risk assessment tools such as risk to injury to self and to others, assessing for depressive symptoms, she should have been more cautious with her approach to the patient. The sharps like scissors could have been stored away from sight. The list is long, and I can only scratch the surface, but you got my point on risk assessments. Had there been protocols in her workplace of not tolerating abusive behavior towards healthcare staff, and if only the nurse had received an appropriate training in dealing with patients with challenging behavior, then this incident could have been prevented. I also believe that communication is the key. Set the expectation of the patients from the time of admission to discharge. That includes the waiting time, the level of staffing versus the number of patients, the expected financial impact, and more. Let me just give you a good example. I have been to the emergency room here in the UK several times, and of course they triage all the patients that come in the emergency room. And once your case is not a high priority, of course you will not be catered right away. What the receptionist would do, they will inform you of the expected time that you will be seen by a healthcare professional. They will give you an average waiting time. So for example, in my case, I've been there for a suspected infection. It wasn't a serious infection, it was a skin infection. So they told me that the waiting time could be about 7 or max 8 hours. So at that point, I already knew that I will be waiting a long time before I will be assessed by a doctor. So that is a concrete example of setting expectation for your patients. In any given profession, we have experienced different kind of challenges and difficulties. But personally, as a nurse, I know that the profession is physically and mentally exhausting, and keeping our cool can be quite challenging for us. But personally, I would suggest for you to avoid confrontational situations, because we will never know that we are putting ourselves at risk in trying to mitigate heated arguments or situations. You've come to realize that, is it really worth the stress? Is it worth the time and the energy? Is it worth the wrinkles? Because at the end of the day, you will go home to your family. You are not a nurse to your family. You are their mother, you're their sister, you're their wife. You are back to your normal self. So you have to offload all the negative energies that you get from work. Let's go back to the incident. Generally, I would say that the victim and the suspect are both victims of the poor healthcare system in the Philippines. However, it doesn't justify for someone to kill over upsetting words. Never.